Predators bite disrupting child's parotid duct. This important article is authored by the following scientists. Biting is a normal behavior of animals, and about 2% of the population is bitten annually by animals. Being in general more common among males, still animal bits have sex predilection. Cat bites are commoner among females, whilst dog bites are abundant among males in spite of being rare in comparison to the incidence of dog bites. Wolf bites are seen among the inhabitants of rural and rugged mountainous areas, which are the natural shelter areas for such predators. The victim's age also contributes to the epidemiology of animal facial bites. Children have an increased chance of being bitten on the face due to shorter stature, the disproportionate size of their head relative to their body making it a larger target, a less well-developed motor skills which are needed to defend themselves with their extremities. In addition, children are less likely to be able to recognize the emotional behavior of animals, so they do not probably evaluate the danger and may be more prone to provoking the animal. Therefore, the incidence of animal facial bites is much more common in children in comparison to adults, 75%, 10%, respectively. Animal facial bites involve mostly the lips, nose and cheeks. Bite wounds are considered complex contaminated injuries requiring an appropriate treatment plan. The most common complication of animal bites is wound contamination by gram-positive and gram-negative microorganisms, as well as salivary complications, salivary fistula. Introduction. Facial animal bites in children happen much more often than in adults, with children making up about 75% of these cases. This is due to several reasons. Kids are shorter, their heads are larger in proportion to their bodies, making them easier targets, they lack the reflexes to protect themselves, and they often can't tell when an animal is acting aggressively. Boys are more likely to be bitten by dogs, while girls more often get bitten by cats, especially in younger age groups. When an animal attacks the face, it commonly injures areas like the lips, nose, and cheeks. The injuries can vary from puncture wounds and cuts to severe tearing of the skin and tissues, sometimes even affecting bones. These injuries not only risk serious infections and damage to vital structures like the airways, eyes, and nerves, but also leave visible scars, which can deeply affect a child's self-esteem. Treating these injuries is challenging because no two cases are exactly the same. Some may only need basic wound care, while others require complex surgeries, such as skin grafts or tissue reconstruction. Beyond physical healing, the emotional and psychological impact can be long-lasting. Many children and their families experience trauma or post-traumatic stress disorder, PTSD, after such attacks. Emotional support and therapy, especially cognitive behavioral therapy, CBT, are often needed to help them recover mentally. Overall, treating animal facial bites in children requires a personalized approach that addresses both physical and emotional healing. The main goals are to restore appearance and function, prevent infection, and support the mental well-being of the child and their family. Conclusion. Successful treatment of facial animal bites, especially in children, depends on quickly repairing the injuries, preventing infection, and restoring any damaged structures, such as important saliva ducts. Proper wound care is essential and includes cleaning the wound, removing damaged tissue, and deciding whether to close the wound immediately or let it heal naturally, depending on how severe it is. Vaccinations like tetanus, antibiotics to prevent infection, and possibly rabies shots are important, especially in areas where rabies is a risk. Children may also need emotional support, as these incidents can cause fear and anxiety. Therapies like art, play, and talk-based sessions help children cope and heal mentally. Preventing future bites involves teaching kids how to understand animal behavior and avoid risky interactions. A combination of fast medical treatment, psychological care, and prevention education offers the best outcome for children who experience facial animal bites. Thank you for watching this video. Please subscribe to our channel BP International to watch more videos in the fields of science, technology and medicine.